across the continent.
The important integral part of this entire vaccine rollout is to understand what are the in-country specific issues which are plugging this rollout to be uniform across the region. The last part I would also trying to bring it up here, while we are talking about 47 of our 54 member states and territories who have rolled out their vaccine, COVID-19 vaccine, there are several countries still who haven't received any vaccine doses yet.
And what are the risks associated with Europe's slow vaccine rollout, and how worried are you about new variants?
Yeah, so I think one of the important elements of this vaccine rollout across all countries in the region and a much faster pace than what we see now will be critical. We are concerned with the pace of rollout. What is important also for us to remember that the slow rollout of the vaccines will also contribute to the prolonging of the pandemic in the WHO European region, but also elsewhere, but also the occurrence of the variants that can emerge because of this slow rollout.
Now, of course, both Easter and Ramadan are coming up. People traditionally move around the country, visit their families. How much of a risk does this kind of movement cause in terms of the spread of the virus?
So we understand that this is a festive time, and these moments also, people look forward to these moments where they can meet their families, friends, and the loved ones. So we understand that these gatherings can happen, and the gatherings in this type of festive occasions also provides that fertile ground, if not all precautionary measures are being taken for the spread of the virus. The virus hasn't changed much since the start, since last 1 year. The tested public health measures remain, and they have proved beneficial and proved useful to contain the virus in several past events or several past months.
The WHO says that Europe's vaccine rollout is unacceptably slow, but you're also urging rich European nations to share vaccine doses. How can both aims be achieved?
The pace of rollout should be that every country, irrespective of their income level or purchasing power, need to protect these two vulnerable groups. The healthcare workers who are saving us or who keep the health system running is extremely critical, and the others who have, looking at the disease epidemiology of COVID-19, these population groups of more than 65 years are either getting the severe diseases or dying. When we talk about people being vaccinated everywhere and countries sharing their doses, it doesn't mean that countries should leave behind everything and start sharing the vaccine with others. When each and every country have taken care of the healthcare workers, social workers, people more than 65, these vulnerable population groups, that is a time when countries need to start looking outwards. Only if we share, only if we also be concerned about the healthcare workers in other countries who are also at the forefront in the pandemic, then only this whole sharing is caring principle will become in reality.
Lockdown in the UK has been especially hard on those with pre-existing